morning, everyone. It's my pleasure to be here for the Epilepsy Awareness and Education Expo. So I'm Hiroki Nariai. I'm one assistant professor of pediatrics at UCLA. I'm gonna talk about what to expect when you get newly diagnosed epilepsy. Okay, are you hearing okay? Right. I have no conflict of interest to disclose during this talk, although I'm getting the generous funding from for the research funding. I really appreciate it. So let me start off with what epilepsy is, because now we talk about epilepsy and we need to know, what that is, right? So medically, it's defined as such, right? Chronic condition in which the brain is prone to cause seizures. Then the easier definition would be someone, so people with epilepsy, someone with more than 2 unprovoked seizures. Okay, so unprovoked seizure means a seizure with no clear causes, such as infection, fever, concussion, contusion, any of those things, right? Then we talk about epilepsy, and then now we are talking about seizures. So I need to define seizures as well. So what is seizure, right? So medical terminology based definition would be something like this. So epileptic seizure is defined as a transient occurrence of signs and or symptoms due to abnormal, excessive, or synchronous neural activity in the brain. It's a little bit difficult to understand, but so you have a brain, and the brain is consisted of numerous brain cells, what we call neurons, right? So those brain cells got too excited, and that manifests as conversions or other behavioral changes. Okay, as opposed to epileptic seizure, we have condition called non-epileptic seizure, where the seizure is caused by not from the epilepsy due to the stress. So it's not related to epilepsy. So during this talk or during this expo, we are talking about epileptic seizures. So the epilepsy, why we talk about epilepsy, because it's really common and it is a problematic, because we have 50 million people worldwide who have epilepsy, and it is one of the most common neurological diseases globally. The incidence is pretty high. It's, 1 in 100 people, meaning 1% of population, have epilepsy at any point. So it's really common. And also the economic burden is significant. It is the same as dementia, lung cancer in male, and breast cancer in female. So as a society, it is a very significant public health problem. And on top of that, epilepsy is stigmatized, right? So that is a huge problem. So 3 things in Bible that stigmatize disorder, which are epilepsy, cancer, and leprosy. So what does it mean, right? So for example, I had 2 close friends. One of them had kidney disease, like nephrotic syndrome. He talks about it, and he talks about side effects of steroid, and he has a difficulty with peeing and those things. He talks about it, and other people are fine. Okay, yeah, that's true. That. So he can talk about it at least. But the other friend, one of my closest friends during elementary school, when we were like 10 or 11, we were playing ping pong. He suddenly fell, started having shaking. Then I called 911. That was the first time that I called 911 in my life, right? We went to the hospital, then his mom came to the hospital, and she told me not to tell anybody about this, because nobody wants to, talk about epilepsy, and mom is really afraid that, my friend, got, bullied at school. So that's really stigmatized. One of the reasons, so back then we were in Japan, but epilepsy are mainly treated by psychiatrists, and we really, as a society, we didn't want to talk about epilepsy. So I think the situation maybe somewhat similar in the United States. And that's why we need to do this educational events, right? So today's main topic is, again, newly diagnosed epilepsy, what to expect. So supposing that you have newly diagnosed epilepsy, then I would like you to ask those, ask those 3 questions, and I'd like you to have answers for those questions. The first question is, why did I develop epilepsy? The second one, what is the type of my seizure? The third one, what do I do for my epilepsy? Right? You have to ask those questions, and you need to have an answer for that. Let me start off with, why did I develop epilepsy? Okay, why is this question important? Because epilepsy can be caused by many reasons. I define epilepsy, but the cause will be different. I'm showing a pie chart on the right-hand side. Majority of the causes, what we used to call it idiopathic, meaning we don't know, in Greek, right? But now we have advancement in medical technology, and now we know that a lot of them are caused by genetics, right? Genetics doesn't mean that you inherit those genes from parents. It doesn't necessarily mean that. Many of them are actually sporadic mutations, meaning you get gene mutation during conception, right? Then the other cause would be vascular disease, meaning stroke, bleeding, congenital, meaning brain malformation, trauma, yes, you have traumatic brain injury, concussion, contusion, tumors, neurodegenerative disease, including Alzheimer's disease in older population, or neurogenetic condition in children. Then the last one would be infectious disease. You have infection in the brain or around the brain, right? But you really need to understand the cause of epilepsy, because the treatment would be different and clinical outcomes would be different. For example, if you have a brain tumor, then typically, those seizures from brain tumor are difficult to treat with medication. But if neurosurgeon goes in and takes out the tumor, epilepsy will be cured, right? Then if you have a particular genetic mutation that is known to cause epilepsy, then you know the natural history of disorder. So we have so many literature out there, then depending on mutation of the genes, you know what to expect. And in many situations, we have some medication choices. Particular medication would work for the particular mutation, and some of the medication would actually worsen seizures. So it's very important to know why you have epilepsy. Typically, we offer some testing in order to understand why you have epilepsy. Then EEG will be most likely be performed. EEG is a electroencephalogram. It is a device to record brain waves, right? So you only get metal stickers on the head, and then we look at the brain waves. Then what is good about EEG is EEG can demonstrate the signature of epilepsy, right? We usually look for a particular signature called spikes. Spikes mean some irritation, the sign of irritation of the brain. Then EEG can suggest type of epilepsy, is it focal epilepsy or generalized epilepsy? And that will help us how to treat those epilepsy. Then if structural cause is suspected, then we'll perform brain MRI. For example, if we feel like this person has maybe brain tumor or maybe brain malformation because you have, particular signature in the seizures, and we might offer brain MRI. But, if we suspect genetic epilepsy and if the patient is doing well with medication, we may not offer brain MRI. Okay. Then again, we talk about recent advancements in medicine. We do a lot of genetic testing nowadays. So if you have epilepsy, we don't know why you have epilepsy in spite of do the EEG, brain MRI, and we may offer genetic testing, but you really have to talk to a neurologist about that. Then the second question is, what is the type of my seizure? It's slightly different question as to why you have epilepsy. So the seizure is a manifestation itself, right? But we kind of need to classify seizure into generalized, focal, or right? why is it important? Because depending on the type of seizure, we treat differently. Because there are medications that are good for focal seizures and the others are good for general seizures. So it will be very helpful to know what type of seizure you have. Then the third question would be kind of main topic of this talk, but what do I do for my epilepsy, right? You may say that's a business for the doctors, but it will be very, very helpful for you to know what to do for your epilepsy. Okay, the first step would be to get the right doctor. You really should be following a neurologist, ideally an epileptologist, meaning a neurologist who specializes in epilepsy, right? So that you can get the right diagnostic plan. As I mentioned, you need to understand why you got epilepsy and what is the type of your seizures. You really need to understand that so that you can make a good treatment plan. So the treatment plan would be mainly medication, and also non-medical treatment might be an option, but mainly the medication will be the first step to treat seizures. Then neurologist will give you several options. You need to know pros and cons of each option. Then you really need to understand, what are the potential side effects and so on. Then medication doesn't work, then you would talk about no medication treatment. I see a lot of patients who come in as a new seizure that they, I get questions like, hey, is it helpful to try CBD or some particular diet or other holistic therapies? But I usually tell them that medication, prescribed medication with the first option, then depending on the situation, then non-medication treatment would be an option later. But again, you really need to have a good discussion with your neurologist. Then it is very important to know the restrictions associated with epilepsy. For example, you are not supposed to swim or bathe unsupervised, right? Because there's a risk of drowning. So also driving is prohibited. If you have active epilepsy, then you can't really drive for 6 months, so you have to be free of seizure for 6 months until you're allowed to drive. That's the situation in California. It's illegal restrictions. And depending on where you go, like, for example, when you go to New York, maybe the restriction may be a little bit longer. So again, you have to talk to a neurologist and know those rules. Then probably the most important thing is to learn and implement safety plan in epilepsy. You really need to know how to deal with seizure, right? So that includes basic life support and also to learn about rescue medicine. So I'll touch on those a little bit. So there's a very nice website in the Epilepsy Foundation talking about seizure first aid, right? This is about, when someone has seizure, what to do. So first step is to, keep the safe environment if somebody is having seizure. Then make sure you protect basic things like ABC, airway, breathing, circulation, right? So airway means, make sure the person has intact airway. So don't put anything in the mouth and make sure, the person can maintain the airway. Then you check if someone is breathing or not. If someone is not breathing, then you help him or her to breathe. Then circulation is checking the pulse. If you can check the pulse, that's great. If pulse is not there, then you start chest compression, right? But again, you have an option definitely of calling 911. And even if ABC is great, but still you call 911 if somebody is having seizures longer than 5 minutes, right? And if somebody is having seizure longer than 5 minutes, then rescue medicine has a role. So I always talk about option rescue medicine when I see patients who have newly diagnosed epilepsy, right? So there are mainly 3 options. One is regular diazepam, which might work for younger kids because it's easier to administer from parents' point of view, right? Then for the older children or adults, I might say nasal spray would be a little bit easier. And we have mainly 2 options, Valtoco and Naizilam. Efficacy would be more or less the same. I think there's a dedicated talk about rescue medicine yesterday, so I'm not gonna talk too much about it today. Then this is kind of scary stuff, but I really need to talk about it. So definitely there's a mortality associated with epilepsy, right? So you have a risk of drowning, because you can imagine if you're swimming, then you have seizures and you might drown, right? The risk of death is much higher compared to general population. Then you have risk of fall or trauma, meaning, let's say if you're climbing up trees or you're standing on a train platform, you have seizure, you fall, that can be very dangerous, right? So you have to be careful about that. Then the risk of suicide is much higher. So we can't really take it lightly, and you really have to think about, seeking care for the mental health when needed. That's very important. Then nowadays, we talk about SUDEP a lot. So SUDEP stands for sudden unexpected death in epilepsy, right? It can happen. So I'm showing the people who had SUDEP, like Cameron Boyce, Griffiths Joyner, and Jet Travolta, son of John Travolta, right? So that can happen in patients with epilepsy, but the cause of death is not really clear. Then we say SUDEP, right? We quite don't know why that happens, but it is likely something to do with our cardiac function and the lung function or breathing function. Okay. This can happen in general, 1 per 1,000 cases, patient with epilepsy, and the rate will be higher if the person with epilepsy have treatment-resistant epilepsy. Just to let you know, this would include patients who are not appropriately treated. So that's why it's really important to know about epilepsy and treat it appropriately. So the risk of SUDEP, the risk is similar between female and male, but mortality is higher in younger patients and one with general tonic-clonic seizures, meaning conversions. And non-etiologies, especially structural lesion, just because patient with structural brain lesion, they tend to have seizures which are difficult to control with medication, right? And in general, uncontrolled seizures, they tend to have higher risks for SUDEP. So so you know all those things, and you have a neurologist, that you really want to discuss a long-term plan, including how to prevent more seizures to occur. So this is probably a very important question, right? So first, you really need to talk about medication. Again, if you have epilepsy, meaning more than 2 unprovoked seizures, 3rd seizure or 4th seizure will likely happen in the future. So you really need to think about how to prevent a seizure to happen, right? Again, medication is the main treatment. I know that some people are scared of medication, but if you use it appropriately, we can minimize the side effects and it can be very effective, right? I said medication compliance, meaning you stick with it. It's not like you skip the medication, you take medication as you like. It's not like that. Once you commit to taking medication, you really need to take medication every day. Then you avoid drug, alcohol, any of those things, because that might trigger seizures, right? Other than that, maintaining healthy lifestyle will be very important, especially maintaining sleep hygiene. If you are sleep deprived, you are more prone to have seizures. This is very important. I sometimes treat, for example, high school students or college students. They're very tired because they have to study a lot, right? Especially the exam. And they tend to get sleep deprived. So I said, you really have to plan things ahead of time so that you don't get sleep deprived. Excuse me. And typically you need to be on medication for 2 years. And then if seizure doesn't happen, that's great. The neurologist can think about weaning medication. But what if the medication doesn't work? The first medication doesn't work, then neurologist will likely offer a second or third, like several other choices. But what if you try several medications, it doesn't work? Then now you get to the category of medication-resistant epilepsy. That happened to be the topic for Dr. Rika Rao. She's going to talk after me, so you get to know, what to do if you go into that situation, right? But again, you really need to have a appropriate neurologist, ideally who specializes in epilepsy, in order to discuss those options. So the summary of my talk, I talk about newly diagnosed epilepsy, then I told you I'd like you to ask those three questions. Why did I develop epilepsy? What is the type of my seizure? What do I do for my epilepsy? Then you really want to discuss it. You just have a good idea of what the questions, what the answer to those questions might be. It will be very helpful to you, your family members, your friends, and even your primary doctors. If you have those knowledge, that might definitely help you. That's the end of my talk, and thank you very much for your attention. And I'm happy to answer any questions you may have.
Thank you, Dr. Nariai.
Thank you very much. Thank you very much for your attention. Appreciate it.